Hello, it's Dr. Chris Lauria from Disc Centers of America in Roanoke, back with our live stream tonight. Hope everybody's doing great and had a great July. Amazing to think August 1st is tomorrow. So this year is just cruising through. But I haven't been on in a while for talking about disc problems today. What we're going to discuss is herniated discs and the best non-surgical treatment for herniated, ruptured, degenerative discs, even bulging discs. There's multiple options for disc problems. The disc basically is a cushioning in between your vertebrae. And the way we describe it, it's a jelly filled donut. And long term wear and tear, um, accidents, traumas, sports injuries can cause a process to start to degenerate your discs, and those discs will lose fluid, they will thin. Sometimes that goo or jelly in the middle will start to push out. That's called a bulging disc. Sometimes that bulging disc and the jello can break open the outer bands of the donut, and that fluid can leak out. That's what a ruptured or herniated disc is. Now, herniated disc can also happen with immediate traumas. It doesn't have to be a degenerative condition. Say you lift something and feel a sharp pain in your back, or sciatic pain going down your legs and a pop in your back. Sometimes that can be a bulging or ruptured disc. Accidents can do it. Trauma, getting hit in the spine can cause disc problems. So they can be very acute situations too, or they can be long-term degenerative changes to the disc. Your options typically for a herniated disc is they will try shots, uh, injections of steroids around the area to help reduce the symptoms of a disc problem. They will also sometimes try physical therapy, and what their goal with that is to strengthen the musculature around the disc to take the pressure off the disc problem. Um, Medically, they'll try medications, painkillers, pain management, those type of things too. But eventually, if those things don't work, you're headed to probably get back surgery. And there's a multiple different types of surgeries they can do. They can do a discectomy where they snip the bulging or herniated disc off. They can do a laminectomy where they cut off a piece of bone, which will allow the disc to spread out further. And the goal is hopefully that it falls off the nerve and your pain goes away. Sometimes, if it's severe enough and you have instability, they can do a surgical fusion of your spine too. But those are very invasive. Um, Most good surgeons are going to want you to jump through every hoop possible before they have to go to back surgery. And hopefully, you don't have to do that either. What we provide in our office is something called non-surgical spinal decompression therapy. And what that is a slow cyclical pumping of the disc. And this is designed to set up a situation where the disc problem can get sucked back into the normal space again and allow fluid and oxygen to re-enter. So this is a non-surgical treatment for the disc problem. And if it's successful, that disc problem gets reduced, that disc gets sucked back into the space, the pressure comes off the nerves, and it allows, obviously, for you to feel better. And the symptoms, whether it's low back pain, neck pain, sciatic pain running down your legs, numbness, tingling in your legs, arms, pain down your arms, will go away. You do have to be a candidate. It doesn't work for everybody. You have to be a candidate for decompression therapy. There are disqualifiers from care. If you're pregnant, obviously we can't do decompression. If you've had surgery on your back and there's already metal rods, screws, plates in your back, you're not a candidate for decompression. If you have compression fractures in your back, you're not a candidate for decompression. If you have an infection in the bone or the disc, you're not a candidate for decompression. So these are all things that can disqualify you from care. But there's other things that I would do to determine that this treatment is going to be successful. Now, uh, decompression, if you're using an acuspina, there's other places that don't use acuspinas, but they use the research that was done in the McClure study, which was done on an acuspina machine, showing 86 to 90% success ratio with people who have decompression treatment with success in helping their disc problems. So there's a high success ratio if you're using that machine. Any other machines you can't tell because the studies weren't done on those machines. So if you hear people giving that success ratio, make sure they're using an acuspina because that's what the studies were done on. There's other studies that were done at Harvard, that also show, an 81% success in 81% success ratio, reducing those disc problems also. There's plenty of research backing this type of treatment. Now, what we do in our office, which is different than other offices, we combine other therapies to help even enhance the decompression treatment more. We use class 4 or cold laser therapy, which is another treatment I can talk about next time, which helps enhance the decompression treatment and helps the healing of the disc by causing a response in that area, which is also very beneficial with our treatments. We can use vasopneumatic therapy. Nobody else in town has that type of treatment. For people who are really severe, we use electroanalgesia, which is electronic pain blocking. And that's where we can interfere with the pain signals, interrupt the pain signals to try to get you out of pain quicker. So these are some other ancillary therapies that we have in our office at a Disc Centers of America office, as opposed to another treatment center that just has the machine. They throw you on there for maybe a quick tryout, which again, one treatment isn't good enough to really reduce the disc problem and allow the full healing and treatment of the disc so you can get maximum benefit. So if you're in that situation, just throwing you on to try to see if it works, it's not even worth doing it, because that's not what these machines are designed to do. It's not a quick fix machine. And in those treatments, they're probably not doing the angles properly or enough weight to make any kind of change. They're just trying to help you feel better so they can get more treatment out of you. But anyway, they do that, and that's fine, but that's not the way we work. So what we'll do is we'll set you up for a consultation where you'll meet with me. I need to do testing, reflexes, muscle testing, specific testing on your spine, review any MRIs or x-rays to make sure this is safe to do, number one, and number two, that it's going to work in your case. And then we'll design a specific program for you that's designed to make sure we get maximum benefit with the number of treatments, utilizing the laser, the electroanalgesia, the vasopneumatic therapy to determine that this is going to be successful. We do very specific testing and EMG tests, which is going to gauge how your muscles and nerves are responding to this. It's an objective treatment, and that's what we're going to use to determine if this treatment's helping you. So if you're interested, let me pull this up here, in setting up that consultation to see if you're a candidate for our program. You can simply call this number 540-600-4630. We'll discuss your case, set up that consultation. There's no charge for the initial consultation to meet with me. We'll do that testing. We'll get your medical records, radiology, and all those types of things to see if this non-surgical treatment would be successful in your case. So if you have any questions, you can easily email me at info@roanokedisccenter.com. You can respond on any of these social medias where this will be posted, and I'll be able to respond to you via social media or probably private message also. So you can do that on any of the aspects that you've seen this video, and we'll be happy to see if we can help you. If you have any questions, please send us. This is a question posed by a patient, and I'll jump on here and discuss them and answer your questions to the best of my knowledge. Okay. Hope you have a great evening. Again, Dr. Chris Lauria, Disc Centers of America. Thank you.